about the shoulder joint that every medical and nursing student should know, along with concise answers. Anatomy and biomechanics. 1. What type of joint is the shoulder joint? A synovial ball and socket joint formed by the humeral head and glenoid cavity of the scapula. 2. Which bones contribute to the shoulder joint? Humerus, scapula that is glenoid cavity, and clavicle that is acromioclavicular and sternoclavicular joints help with movement. 3. What are the major stabilizers of the shoulder joint? Static stabilizers. Glenoid labrum, joint capsule, ligaments. Dynamic stabilizers. Rotator cuff muscles which include supraspinatus, infraspinatus, teres minor, subscapularis. 4. Which ligament is most important for preventing anterior dislocation? Inferior glenohumeral ligament. 5. Which muscle initiates shoulder abduction? Supraspinatus for first 15 degrees, then deltoid takes over. 6. What are the primary movements of the shoulder joint and their corresponding muscles? Flexion, anterior deltoid, pectoralis major. Extension, latissimus dorsi, posterior deltoid. Abduction, supraspinatus for 0 to 15 degree, deltoid for 15 to 90 degree, trapezius and serratus anterior for greater than 90 degrees. Adduction, pectoralis major, latissimus dorsi. Internal rotation, subscapularis. External rotation, infraspinatus, teres minor. Clinical conditions and injuries. 7. What is the most common type of shoulder dislocation? Anterior dislocation seen in 95%, often caused by excessive abduction and external rotation. 8. Which nerve is most commonly injured in anterior shoulder dislocation? Axillary nerve causes deltoid muscle weakness and loss of sensation over the lateral shoulder. 9. What is the most common cause of shoulder pain in adults? Rotator cuff tendinitis, usually involving supraspinatus. 10. How do you test for supraspinatus injury? Job's test, which is empty, can test arm abducted to 90 degrees, internally rotated the thumb down, resisted downward force causes pain, weakness. 11. What is the most commonly torn rotator cuff tendon? Supraspinatus tendon due to repetitive overhead activity or trauma. 12. How do you test for infraspinatus and teres minor function? External rotation resistance test. Resisting external rotation of the arm at 90 degrees elbow flexion. 13. What is frozen shoulder adhesive capsulitis? A condition with progressive loss of active and passive range of motion, commonly associated with diabetes and prolonged immobilization. 14. What test is used for diagnosing shoulder impingement syndrome? Neer's test. Pain when the arm is forcibly flexed while the scapula is stabilized. 15. What is the most common fracture in the shoulder region? Clavicle fracture. Middle third is the most common site. 16. What is the Popeye sign? A bulging muscle belly of the biceps seen in biceps tendon rupture. Special tests and physical exam. 17. How do you test for a labral tear? O'Brien's test. Arm forward flexed 90 degrees, adducted, internally rotated the thumb down, resisted downward force causes pain. 18. Which test is used for shoulder instability? Apprehension test. Patient's shoulder is abducted and externally rotated, a feeling of impending dislocation indicates instability. 19. What is the drop arm test used for? Detecting rotator cuff tears. The patient is asked to slowly lower their abducted arm, a sudden drop indicates a tear. 20. What is the speeds test used for? Biceps tendinitis, pain when resisting forward flexion of an extended elbow. Management and treatment. 21. What is the first-line treatment for rotator cuff tendinitis? Rest, NSAIDs, physical therapy, and subacromial corticosteroid injections if needed. 22. What is the initial management for an anterior shoulder dislocation? Closed reduction, e.g., Stimson, Coker, or Milch technique, followed by immobilization and rehabilitation. 23. What is the most common complication of proximal humerus fractures in the elderly? Avascular necrosis of the humeral head due to disruption of the anterior and posterior circumflex humeral arteries. 24. Which imaging modality is best for detecting a rotator cuff tear? MRI best for soft tissue evaluation. 25. How do you differentiate between rotator cuff tear and impingement? Rotator cuff tear, right pointing arrow, weakness on resisted movement. Impingement, right pointing arrow, pain but preserved strength. Bonus: shoulder joint mnemonics. Sits for rotator cuff muscles. Supraspinatus for abduction. Infraspinatus for external rotation. Teres minor for external rotation. Subscapularis for internal rotation. TUBS for traumatic shoulder dislocation. Traumatic. Unilateral. Bankart lesion. Surgery often needed. Ambry for a traumatic shoulder instability. Atraumatic. Multidirectional. Bilateral. Rehabilitation first. Inferior capsular shift if needed. Keep learning and stay ahead. The shoulder joint is one of the most fascinating and clinically relevant joints in medicine. Mastering its anatomy, biomechanics, and common pathologies will not only help you excel in exams but also in real-life clinical practice. If you found this helpful, subscribe for more high-yield medical content, mnemonics, and exam tips to boost your learning and confidence. Stay curious, stay motivated, and keep pushing towards excellence in medicine. Subscribe now and never miss an update.